Hello there, my name's Thomas, and this is our group of awesome physios here at Physio Solutions. I want you to come with me today, and we're going to chat a little bit about distal radius fractures. Since you're already watching this video, I'm sure you've heard about complex regional pain syndrome, but just in case you haven't, we're going to go chat with Nathan, one of our physiotherapists, to give us more insight.
So complex regional pain syndrome, or CRPS, is a condition that very frequently can happen after a distal radius fracture. It varies from person to person, but it can last up to weeks or months or even sometimes years for some people. Although it does vary from person to person, there are sort of some common symptoms that do present in most people. Things like pain, swelling, redness, sort of changes to the color of your skin, and your skin can often become quite cool, as well as hypersensitivity to cold and to touch. And although some of these symptoms can be quite severe, treatment for CRPS is most effective when began early. And one of the most common physical therapy treatments for this condition is called desensitization.
So now that we know a little bit more about complex regional pain syndrome, we finally found Heather back in the treatment area to tell us more about desensitization. So let's talk with her. Hi Heather, can you tell us a little bit more about desensitization and what the goals are?
Yeah, for sure. So the goals of treatment overall are reducing pain, preserving limb function, and helping people return to work. The goal of desensitization therapy specifically is to reintroduce textures and feelings in a gradual manner. So we start with low intensity, gradual stimulation of the painful or overactive receptors in the arm. So we use different textures, light massage, and graded motor imagery, and gradually build up in intensity until the painful sensitivity has minimized. Sometimes sensation stays altered, but the goal is to minimize the pain due to CRPS.
Okay, that makes sense to me, but do you think we'd be able to see something like this so that when people are following the video at home, they know exactly what to do?
Absolutely, and I know Bree does this a lot in practice, so I think she'd be a great person to show.
All right, Bree, thanks so much for meeting me. I understand that you've got some techniques here that patients can use at home for desensitization.
Yeah, so Tom, what we have here is a bunch of objects with different textures. So right down here is a scarf or a soft blanket, and then a soft sweater, and you can use like Velcro, and that would be a more rougher texture versus a softer texture.
Mm-hmm.
So with that, using the different textures is very helpful because you will start with using the softer and progressing slowly up to the rougher textures.
Okay.
So actually I'm going to show you this and how to do it. So if you don't mind putting your arm up here, so you want the arm nice and relaxed.
Mm-hmm.
I'm going to take the softest one. And what you're going to do is you're going to rub the object up and down the arm nice and slowly.
Okay.
And you want to cover a big area. So you're going to also want to turn your arm so that I can get the full arm in there, okay?
Sure.
So you want to do that for about a minute per object. And as long as that goes well, then you can progress to something a little bit rougher.
Okay, that's great. I understand about how to progress from one soft thing to a rougher thing, but when do I know it's time to progress?
Okay, that's a great question. So how you will know is, to be honest, it will be uncomfortable, and that's normal, but you don't want it to be very painful.
Okay.
So what you want to do is you want to do the one object for a minute, and then as long as that goes well, you can progress to the next object. Gotcha. And then go from there, and you want to be able to take breaks in between, and you want to repeat that.
Okay, I think that makes a lot of sense. I think most of our viewers at home could follow along with that, so thank you so much for the useful information.
No problem.
All right, Andrea, so we just met with Bree, and she taught us all how important home exercises are for CRPS.
You're right, Tom. So with CRPS, we want to make sure that you're doing these exercises about 6 times a day. So the more you do it, that's going to help with the effectiveness and hopefully have improved outcomes over time. So after you have your first initial assessment, you'll get a sheet similar to this from your physiotherapist. It'll have the days of the week along the side, and along the top, there'll be spaces for you to put in whatever objects you're going to be using. So we just put in the examples that Bree used, such as the blanket and sweater and paper towel, but you can use whatever you'd want. So when you go to fill this out, there'll be boxes. So like I said, each time that you do it throughout the day, you can write down how long you do it for. So if you use the blanket for 1 minute, you write down 1 minute, and then you progress to the sweater for about 45 seconds. If that's the end, that's okay, then you just try again for the next time. Throughout the course of the week, you'll hopefully see a progression as you go longer times for each level, and across you'll move into materials that have a rougher texture. But of course, these are just recommendations, so you'll want to talk to your physiotherapist to make sure that they give you the proper specifics for your case.
Awesome, Andrea. Thanks so much. Thanks for joining us today. We hope you've learned something from this, but also realize that these are just examples. And when you work with your physiotherapist, they're going to give you an individualized plan that best suits your needs. Thanks so much, and we'll talk again.